We see differences on the country-specific figures between the different countries. Obviously, we cannot comment on the differences themselves between countries. Very often, such differences can arise, for instance, in the context of calculation of mortality rates, where we see sometimes differences.
Stefan, can you bring your microphone a bit
sorry.
closer to your mouth? Thanks.
Okay, I'm sorry. So I was just saying that we cannot comment on specific country-specific figures. Obviously, we see that there are differences in mortality rates linked to the coronavirus. One possible reason for this can be the differences in testing policies in countries. Other factors which could also explain for the differences in these rates might be the fact that some member states take different measures, that the rate of the growth of the outbreak is different, that the healthcare system capacities can be different. So there are different elements to be taken into account. What is very important here as well is that in the context of our joint roadmap, which was presented by President Michel and President von der Leyen, monitoring capacity is one of the important criteria for lifting the confinement, meaning that we have, among other things, to ensure there is a very good and solid testing. Now, the ECDC, in collaboration with its networks, is obviously an important partner here in terms of working out and these testing strategies. I also remind you of the fact that last week the Commission has adopted specific guidelines on testing and the performance of testing, all with a view to have reliable data, which is and will be important in the context of leaving our confinement.
Stefan, follow up, but have you proposed specific guidelines on counting, not on testing, but whether, for example, what to do with the patients in retirement homes and so on?
Stefan, have we?
Yeah. Well, sorry.
Yeah, go ahead. You heard the question?
No. Yes, indeed. Well, I think what we should also not lose sight of is that member states obviously have the responsibility to make sure that there is a correct counting, a correct testing, and so on. So we very much also rely on the work which is being done there. But as said, the ECDC, as one of our important scientific partners, is there to help with coming to, I would say, solid scientifically based approaches here, taking into account obviously the fact that there are very country-specific specificities, I would say.
Okay, thank you. I still have